In Aaron's case, this started when he was 15 years of age. And like most 15-year-olds, he was extremely athletic, he liked to play. All he wanted to do was play. He doesn't come to the doctor because he wants to complain. In fact, he hates to come to the doctor like most people do, not to mention 15-year-old kids. But Aaron's a special case because Aaron has a case of juvenile onset diabetes. So that puts him in a little separate category. He has to monitor his blood sugar, insulin and sugar levels all the time, and it's a tremendous burden on him. And one thing that he has chosen is to be a competitive roller skater. Now, you may not know this, but I'm the team physician for the Milwaukee Admirals for the last 10 years. So I take care of professional hockey players on an almost daily basis during the season. Never taken care of a competitive roller skater before. And so I had to learn what the similarities and differences between roller skating and ice skating were, and try to apply those differences to Aaron's case to do the best I could for him under the circumstances. So in this case, we have a young athlete with a patella, a kneecap, that was sliding out of place, causing pain. So his two symptoms were instability, my knee gives out, and knee pain, my knee hurts. And so we needed to manage those two symptoms. The very first thing that I did after looking at him, getting some standard x-rays, was to send him for some physical therapy, because the majority of young athletes who have this problem can be treated well with physical therapy. They don't go on to needing surgery. So in Aaron's case, the physical therapy was not giving him the relief that he needed. And he had a national competition coming up that he told me about that he didn't feel like he could prepare for properly with the knee functioning the way that it was, despite the use of a brace, despite the use of his physical therapy. So we decided that he was going to be one of the fewer patients who are going to require surgical treatment for this. Now, traditionally, the surgery for patellar instability has involved going in and making an open approach to the knee, in other words, making an incision in the knee, and doing something to either tighten up the ligaments in this location, or sometimes to actually cut the bone down here to move the whole bone, move the bone over so that the kneecap isn't so prone to dislocating. And in Aaron's case, there are certain instances where you need to do the bone procedure, where someone's alignment is so poor that you can't get away any other way. In his case, though, his alignment wasn't all that bad, and what he needed was tightening of the ligament on the inside that prevents the kneecap from sliding out of place. That's where the advances in arthroscopic surgery have really taken us to new levels. So 15 years old, I wanted something that was less invasive. I wanted something that would be that would heal relatively quickly, because not only is he going to push me to the extreme of activities as quickly as possible, as most 15-year-olds would, but he also has juvenile diabetes. And so, like with any diabetic patient, I would be concerned about whether he'd heal more slowly than the typical patient that does not have diabetes. So the surgical procedure for this is where from the inside, it would be this side, I want to tighten up the ligaments between the kneecap and the femur right here, so that we bring that down and bring that over, so that this kneecap is not able to slip out of the place going that way, and that would be the outward direction.